It is not uncommon to see such posts on Facebook, WhatsApp, or Twitter. The messages are often dire and urgent, sent by panicking relatives of patients who've been asked by the hospital to find a matching donor for an emergency medical procedure. There are websites, forums, and even apps to facilitate emergency blood donation. But blood collected this way is almost never used on an urgent basis. For one, it takes at least 1 day to test for compatibility or infections. While donors think they are donating blood to be used for the patient who called them, the blood actually goes into the blood bank as replacement. According to the National Blood Policy, hospitals are not supposed to ask patients or relatives to arrange for blood, but replenish the stock in blood banks via voluntary blood donation camps. In practice, though, it rarely ever happens. This is despite many states in India having excess blood. Nationally, against a requirement of 1.2 crore units of blood, around 1.08 crore units were collected in 2015, a shortage of 11.5 lakh units. As per the National Blood Transfusion Council rules, it is illegal to donate blood non-voluntarily or for money. So why do hospitals coerce patients to get blood? While some say it is for the sake of convenience, others claim it is done for profit. When patients require blood, most times it is only for the red blood cells. Donated blood is usually segregated into 3 components: RBCs, platelets, and plasma. The shelf life of RBCs is 35 to 42 days. For platelets, it is 5 days, while plasma can be stored for up to a year. It is lucrative for hospitals to use the remaining components on other patients. Hospitals, on the other hand, claim the reason they ask for fresh donors is to adhere to quality control. But experts claim getting blood from fresh donors or a blood bank carries the same risk. So while the law doesn't prevent hospitals from demanding replacement donors, it is a needless cause of anxiety for many patients and their relatives.